Hello, this is Dr. Huck, and today I'll be discussing the effect of diabetes on kidney function, and we'll be dealing with the mechanisms, symptoms, and testing for kidney problems with diabetes. So, what does the normal kidney do? As you know, kidneys are a pair of bean-shaped organs located in the upper abdomen. Their main function is to remove waste, but they also are important in the balance of electrolytes, fluids, and acid base. In addition, they are also important in regulation of our blood pressure and in production of red blood cells. Kidney damage from diabetes can do one or two things. One is it may cause buildup of waste material that normally is excreted by the kidneys. These include something called creatinine as well as blood urea. Or it may cause loss of molecules, important molecules for the body like proteins and red blood cells. So how do we pick up damage from diabetes at the level of kidney? Well, we can do that by measuring albumin level in the urine. Albumin is a normal protein in our blood, and normally when our kidneys filter blood, it is able to hold on to albumin and other proteins. In early stages of kidney damage from diabetes, the filtration rate in the kidney is actually increased because of increased pressure inside the glomerulus. As a result, you develop tiny gaps between cells that line up the filtration unit of the kidney, and these gaps allow a small amount of albumin protein to leak into the urine. This small amount of albumin is called microalbumin, and by definition it occurs when the albumin in the concentration in the urine is less than 300 milligrams per gram of creatinine. That level of protein in the urine cannot be picked up by a typical urine dipstick, but it can be measured by more sophisticated testing. And if you have that, that means that you have early damage to the kidney from diabetes. Now, when this level is above 300 milligrams per grams, it is called albuminuria, and that basically indicates a more severe level of kidney damage. Now, in those early stages, the diabetic damage to the kidney can be reversible, but when the kidney damage becomes a little bit more severe, you start to see changes in blood creatinine level. Blood creatinine level is another way of checking your kidney function. Essentially, creatinine is a waste product which is formed when our muscles contract. Creatine is a natural amino acid which provides energy to muscle cells so they can contract. And when they contract is when creatinine is produced from creatine. Creatinine is normally filtered and removed from our bodies by our kidneys, but if they don't do so, the amount of creatinine in the blood starts to build up. A normal creatinine level in a woman is less than 1.2 milligrams per deciliter, and in a typical man it's less than 1.4 grams, 1.4 milligrams per milliliters. If the values are above that, they may indicate kidney problem. Since the creatinine comes from creatine in the muscle, the creatinine level in the blood is affected by kidney function, but also by the muscle mass or the size of the patient. So blood creatinine levels are inversely related to kidney functions. If the kidney function is low, the creatinine level will be high. But a more useful way to judge kidney function is to use this creatinine level and apply a special formula which will give you an estimated value of something called eGFR. GFR stands for glomerular filtration rate, and it correlates well with the kidney function. So the kidney damage from diabetes will show low eGFR in general, with or without the presence of albumin in the urine. Just based on the eGFR alone, the term CKD, or chronic kidney disease, is defined as a decrease in eGFR less than 60 milliliters per minute. So this diagram shows the 5 stages of kidney disease as defined by the GFR. Stage 1 kidney disease occurs when the creatinine, when the eGFR is above 90, so which is normal, and it may be actually high, but there is some protein in the urine. The stage 2 occurs when the GFR is between 60 and 89. Stage 3, eGFR is between 30 and 59. Stage 4, 15 to 29. And stage 5, or end-stage kidney disease, is less than 15. At that stage, you start to see symptoms and complications of kidney failure, and this is when the patient may start to may need to go on dialysis. So the diabetic kidney disease, or diabetic nephropathy, is important. It's important because it's quite common. So now diabetes is the leading cause of end-stage kidney disease, leading to dialysis in the world. Half of new cases of kidney failure are from diabetes. 40% of patients with type 1 diabetes will have some kidney disease at some point, and almost half of type 2 diabetes patients will also have CKD, or chronic kidney disease. Uncontrolled diabetes damages small blood vessels in the kidney, called microvascular damage, and this is the mechanism by which it leads to kidney problems. To make things worse, diabetes, particularly type 2 diabetes, occur in patients who also have what we call metabolic syndrome, which is a condition that includes high blood pressure and high cholesterol or body fats. These conditions also cause damage to blood vessels and kidney, and when they occur together, the risk of kidney damage actually multiplies. This is an important point in order in patients who are trying to protect their kidneys, because you have to simultaneously handle glucose abnormalities, blood pressure problems, and cholesterol problems in these patients. So here's a diagram that shows the damage of from diabetes to the kidney. This damage occurs over time. High glucose readings that are not controlled lead to increased filtration in the kidney. This increases the pressure in the kidney, and that leads to leakage of protein or albumin with time. Ultimately, though, kidney function would start to suffer. As you go through stage 3, 4, and 5 of the kidney disease, you start to see accumulation of waste material and fluid build up in the body. So blood pressure becomes more of a problem. And ultimately, you start to get symptoms from buildup of these toxic materials, and that's when you start to plan dialysis in these patients. So when do symptoms appear? The problem is the symptoms may not appear until late in these patients, stage 3 or stage 4 kidney disease. And the commonest symptom is that the patients will experience difficulty controlling blood pressure in the beginning. Eventually, though, they will start to have some swelling or edema. The problem is edema or swelling can also occur as a side effect of some medications for blood pressure, such as amlodipine. But eventually, as kidney functions get worse, patients will start to have problems like high potassium or acid buildup, low calcium level, frequent urination, and eventually headaches, nausea, depression, sleepiness, and eventually death can occur in patients if they're not treated and they have kidney failure. In addition, the problem is that patients who have this degree of kidney problem from diabetes also have a very high risk of having heart attacks, angina, or stroke. So you have to watch the patient very carefully for that. So the natural history of type 2 diabetes and kidney disease is shown in this diagram. As you can see, it takes years to develop, and there are in the initial part tends to be reversible, but as structural changes occur in the kidney, things become more irreversible and more progressive. You start to see more and more protein in the urine. The level of creatinine in the blood starts to go up, and blood pressure becomes more difficult to treat. So this can become a very serious condition. The good news is that it is preventable and manageable or treatable. And in part two of this presentation, we will review what you can do to prevent or treat diabetic kidney disease or diabetic nephropathy. Thank you and good luck.